Hello everyone, welcome back to my YouTube channel. Today we are going to talk about frontal bone. We will start our topic with introduction. Frontal bone is one of the most important bones in human skull that forms the forehead and extends superiorly to cranial cavity. It plays a significant role in protecting the brain, shaping the face, and providing attachment points for muscles involved in facial expressions. The frontal bone also contains various anatomical features that contribute to functions such as vision, sensation, and movement. Now let's talk about structure and location of frontal bone. Frontal bone is single bone located at anterior portion of skull. It is broad and flat, forming the forehead, the upper orbital regions that are eye sockets and part of cranial cavity. It articulates with several other bones including the parietal bone, sphenoid bone, ethmoid bone, nasal bone, zygomatic bone, and maxillary bones. The bone consists of two main parts. The first is squamous part, that is large flat region forming the forehead, and orbital part, that is a section that forms the superior portion of the eye sockets and contributes to the protection of eyes. Additionally, a small portion called nasal part forms the upper boundary of nasal cavity. Now let's talk about the anatomical features of frontal bone. Frontal bone contains several notable landmarks with several different functions in the skull. These are frontal sinuses, that are air-filled spaces within the frontal bone located above the nasal cavity. These sinuses are lined with mucosa and help with humidification of air and voice resonance. Other anatomical features include supraorbital margin, that is the superior boundary of the eye socket providing structure and attachment point for the facial muscles, and superior supraorbital foramen or notch, that is a small opening on each orbit that allows the passage of nerve and blood vessels supplying the forehead and upper face. And it also has glabella, that is a smooth, slightly depressed area between the eyebrows contributing to the contour of the forehead. And the next feature is coronal suture, that is a junction where the frontal bone articulates with the parietal bone at the top of the skull. And these anatomical features help define the structure of the face and provide pathways for important neurovascular components. Now let's talk about the functions of frontal bone. The frontal bone is essential for multiple physiological and structural functions, including protection of the brain. The frontal bone forms the anterior part of the cranial vault, serving as a shield for frontal lobes of the brain, which are responsible for cognition, behavior, and voluntary movements. The second function is support for facial muscles. The frontal bone provides attachment point for the muscle involved in facial expressions, including those responsible for raising the eyebrows and moving the forehead. And the third function is facial structure and aesthetics. The shape and positioning of the frontal bone influence the appearance of the forehead and upper facial features. And the fourth function is housing the frontal sinuses. These sinuses assist in reducing the weight of the skull, humidifying inhaled air, enhancing voice resonance. Now let's talk about the clinical significance of frontal bone. This includes fractures. The frontal bone is prone to fracture, especially from trauma, such as falls or vehicular accidents. Fractures can affect the sinuses, orbital margins, or cranial cavity, leading to complications like cerebrospinal fluid leakage. And the second significance is sinus infection, that is also called as frontal sinusitis. That is inflammation of frontal sinuses that can lead to pain, pressure, and difficulty in breathing through the nose. Chronic infection may require medical intervention. The third significance is surgical importance. The frontal bone serves as a reference point in neurosurgery and reconstructive procedure for treating skull deformities or injuries. Now let's talk about the conclusion of our lecture. Frontal bone is one of the most vital components of human skull, contributing to brain function, facial aesthetics, and function aspects like movements and respiration. Its anatomical landmark provides structural stability and attachment point for crucial muscles and ensuring various physiological processes. Understanding its significance is essential for medical and anatomical studies. So this was about frontal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.